Welcome, everyone. My name is Dr. Ben Howdige. I'm with Inland Empire Health Plan, and I am also your founding board chair of the Inland Coalition on Aging. So it's my honor to be here and to chair these meetings and partner with you, everybody on the call here, to further the Inland Empire Master Plan for Aging. That's going to be a blueprint for our older adults, people with disabilities, and caregivers living in the Inland Empire. Our goal is to improve quality of life by integrating services, expanding long-term service and supports, and having this Inland Empire Master Plan for Aging available to elected officials, county department leaders, executive directors of nonprofit organizations, faith-based organizations, everybody who serves this community. We will make this Inland Empire Master Plan for Aging available to everybody. So today on our agenda, I want to welcome you again. I'm going to go over some key points from our last meeting, just as a refresher. Very excited to have a guest speaker today from AARP, who's going to share with us a network of age-friendly states and communities. I'm excited to hear this presentation. I think it's, I've been wanting to see this in the Inland Empire for years, and hopefully we can start pursuing efforts to become an age-friendly Inland Empire. We're also going to have some Inland Empire Master Plan for Aging updates. And then we'll talk about next meeting. And there's a post-meeting poll. Very important that we get your input. As you know, these meetings are your meetings, our meetings, and we want to make these meaningful. And so we try to focus all of our activities on something that's going to add value to your time, our time. And so the polls are very important because, again, they're going to drive these meetings and help us to further our mission of age-friendly community here in the Inland Empire. So welcome again to everybody who's joining. Let's see. So key points from last meeting. We shared some information about the California Master Plan for Aging. And here on this slide, you'll see some, we have a listing of, I'm so sorry, of links to the California Master Plan for Aging. A MPA implementation tracker is available there, also a link. There are several committees at the California Master Plan for Aging, and our local Inland Empire Master Plan for Aging has some subcommittees. So we encourage all of you to be a part of this monumentous effort to implement an Inland Empire Master Plan for Aging. There's so many reasons for doing this, not only the current needs and gaps in services, but also the needs that are coming our way. It is projected that we are going to have a 682% growth increase in older adults in the Inland Empire by 2060. So that's, I'm sorry, let me read this again. Age 65 and over population growth by region is projected to grow 682%. And so we need to prepare. Now's the time. And so very excited to be working on this Inland Empire Master Plan for Aging. Next slide. By the way, you're welcome to put your name and title, organization on our chat. We welcome you to introduce yourself really quick to everybody. And that way folks can know who's here with us and part of this coalition. If you are not a coalition member, I invite you to join. If you wouldn't mind going to our website, either as I'm speaking or later today, go to our website, inlandaging.org, and you can sign up to be a member of this coalition. It is free. It's open to professionals, anybody that works in the field and is wanting to roll up their sleeves and make this a better Inland Empire. We welcome you. We invite you. Last key point from the last meeting and every meeting is to help us spread the word, help us spread awareness about the Inland Empire, the Inland Coalition on Aging, and the Inland Empire Master Plan for Aging. The Master Plan is our first and only initiative right now, and once we have that, we'll have a good foundation to build upon that. And so if you hear the focus on the Master Plan, it's because that's going to give us a foundation to build upon and continue to innovate and expand services, integrate services. So we're very excited about the Master Plan for Aging. We do have lots of resources on our website. If you go to inlandaging.org, you'll see that we have a one-page flyer, we have a trifold brochure, we have a social media toolkit, and an informational video available on YouTube. Love the video. Check out the video. It's a brief video about the Inland Coalition on Aging, what we're doing, our efforts, and it highlights a few key people who have a charge for us to really get involved with the Inland Empire Master Plan for Aging. Next slide, please. So as I mentioned earlier, I'm very excited to introduce our next speaker because I've been reading about the AARP efforts to make age-friendly communities a reality in our communities, in our state, in our country, and they've done a phenomenal job of doing that. I think this is definitely aligned with our goal, our mission at the Inland Coalition on Aging. I know it is definitely aligned, and so we are pursuing this. We want to orient you to this, and hopefully you'll be on board and join us as we try to make the Inland Empire an age-friendly community. But I'm going to turn it over to Rafi Nazarians. He's the Advocacy Director for the California AARP.
Right. Yes. Thanks, Ben, and thanks, Rafi, for being here. And so I'm going to be sharing some updates on our Inland Empire Master Plan for Aging. One thing I do want to mention is that part of our scope of work for the Master Plan on Aging is becoming an age-friendly community. And so as part of the development of our Master Plan on Aging that we're putting together right now, we are going to be applying to be an age-friendly community, and we're going to be applying on behalf of the Inland Empire. So we're going to be applying for both Riverside and San Bernardino counties. And so right now, where we're at in that process is we're in the process of getting support from our boards of supervisors from both counties. But like Rafi said, there are also cities that can participate. And I kind of feel like even though we will be applying on behalf of both regions, it is important for each city also to apply themselves because we have two regions that are very diverse. And even though we have completed some assessments and we've done, we're kind of where we're at in the process is we're developing the plan, we're working with the work groups. Each community is different, each city is different, and there might be things that we're not capturing or that we're missing. So we can definitely, I like Ben's idea of inviting the cities, informing them of this process, encouraging them also to become age-friendly communities. The more the better. That means that we would have more, support within our Inland Empire. That map that Rafi showed with only the city of Riverside in both of our regions currently an age-friendly community, and yet we're the region that has the projection of having 682% increase by 2060 of older adults in our communities. We need to have more people join, to become age-friendly communities because of that growth. And so I think it goes above and beyond even just having the counties apply, but each city and each community. I also saw on the map that like in the area of Los Angeles, he mentioned LA County has applied to become an age-friendly community, but then also LA City, and there's other cities involved. And so I'd like to have more dots in our Inland Empire region, right? Have more communities become age-friendly communities. So that can certainly be a part of what we're trying to do with our own Inland Empire Master Plan on Aging. Can you go on to the next slide, please, Janelle? And so mentioning the scope of work, like I said, this project of creating the Inland Empire Master Plan on Aging, we're on year 2. So it has been a long process. Just wanted to give you an update on where we're at in the process. And so the items that you see a check mark by are things that have been completed. And so we've formed an advisory committee, and that's checked off. We've also reviewed existing data. So that includes data from both counties. We've held listening sessions. And, it's great that Rafi made that point that we can transfer our findings into that portal once we have become an age-friendly community. We're created a preliminary report with findings and recommendations, right? And so the report is here, a picture of that report. This is the report that we're working off of in the work groups that we have currently formed. And that report, again, is available on the Inland Coalition on Aging website. And so now the items that have not been checked off and that we're working on. And one of them is to become an age-friendly community and to apply on behalf of the Inland Empire, where, we will be applying on behalf of both Riverside and San Bernardino counties. We're also in the process of brainstorming items and identifying resources within each of our work groups. And I'll give updates on where we're at with our work groups shortly. We also are building awareness, and that's an effort that we're asking your support in, right? Helping us spread the word of what we're doing, helping more people be informed. And, in doing so, then we get more people interested in the process of becoming an age-friendly community, and also in the hope that more cities apply as well. And we're going to be drafting the local master plan on aging, right? Which we hope to have completed by March 31st of 2025. The plan that we are completing or putting together will span 3 years. So it will go from 2025 to 2028. And our goal is to have that finalized, approved by March 31st of 2025. So we still have a ways to go in getting that finalized. And one of the things that we're working on right now to help us get closer to that goal is, can you go on to the next slide, please, Janelle? Well, before that, I did want to share, we applied as the Inland Coalition on Aging. We applied to the CCLTSS grant that works along with the SCAN Foundation to receive funding to help enhance our ICA membership and also to amplify diverse representation and explore equitable systems change. And so I do want to announce that the Inland Coalition on Aging has been awarded the grant. And so those funds will be used. It's a $20,000 grant that we've received. Those funds will be used to enhance our ICA membership, in which will include us completing a membership survey and comparing it with IE census composition of our regions. We're going to be doing some targeted outreach. We're also going to be using the funds to help with social media outreach, digital outreach, presentations, and health fairs in the community. And one of the other goals of this grant is to reduce silos of service. So we're going, and this is happening in the work groups process where we're narrowing down the recommendations. And it's also going to enhance our current education and awareness campaign. And so the funds are going to be used for these two, making you aware of that in this, helping us enhance our membership since we just completed our relaunch. We need more members, right, to make all of this possible. To implement the master plan that we will be creating, we need more members in our Inland Coalition on Aging. Next slide, please. And so now updates in our work groups. As I mentioned, we have 4 work groups right now that we're working on. Behavioral health work group that is currently meeting the second Wednesday of each month from 3 to 4. Our transportation work group is meeting the second Wednesday of the month from 11 to 12. Our caregiving, Alzheimer's, and all other dementias work group also meeting on Wednesday from 9 to 10. And then we have our housing work group that is meeting the 4th Wednesday of the month from 2 to 3. Our next meeting for the housing work group is actually tomorrow. So for those that are involved in that work group, we'll see you tomorrow for that. And so what have we done so far in our work groups? So we've had 2 meetings in our caregiving and Alzheimer's and all other dementias work group, as well as transportation and behavioral health. And we started off by doing, introductions of everyone. We've conducted a survey in each work group where work group members reviewed the recommendations within each of the domains and commented on what they thought was feasible for us to complete in our Inland Empire region. We took those survey results and we presented them at our meeting that we held, our meetings that we held last week. And so now we're in the process of asking other members to participate in our work groups, specifically for the caregiver and Alzheimer's work group. We're also going to be learning about health systems in place that integrate early dementia diagnostic. And we're also working on learning about current advocacy efforts that relate to caregiving and Alzheimer's and all other dementias. So that's where we're at with our caregiving and Alzheimer's work group. If you're interested in participating in that work group, please send us an email at info@inlandaging.org. If you want to participate in any of these work groups, send us an email so we can add you to that participation list. In our transportation work group, we also reviewed current services that are available in the community, and we found that there is a lot available. And what we need to do more is enhance our education awareness about these resources. So our next steps include selecting the most viable recommendations that we have been reviewing, as well as identifying other resources in the community that could be beneficial to our clients. Next, please, next slide. In our behavioral health work group, we had a really rich discussion last week on current services that are available in regards to behavioral health of older adults, persons with disabilities, and caregivers in both Riverside and San Bernardino counties. And so we had really great presentations by our co-chairs about what those resources are. So at our next meeting, we will be discussing our survey results and also discussing next steps, since we do, like I said, we have a lot of rich resources in both communities. How do we get those resources out to the public? And then finally, our housing work group, like I mentioned, will be meeting tomorrow from 2 to 3. We also completed a survey in that work group to review the recommendations. So tomorrow we'll be learning about what those survey results were, as well as learning about resources as they pertain to housing. So again, if you want to be involved in any of these work groups, please send us an email at info@inlandaging.org. I see in our list of participants in the meeting today, there are several individuals that have participated in the work groups already. If any of you want to share any additional information on how the work groups are going, please raise your hand, and we're free to share if you want to about how the work groups are going so far.
I think this is Cheryl Brown again. I first of all think that the work groups are going very well. And when I go to Sacramento and we're meeting with the community up there of older adults, and that means CDA and others, I always talk about our transportation issue. I think Kim McCoy Wade was at one of the meetings, and I said, you know, we worked on this master plan for aging for a year and transportation wasn't important. I said, but in our area, transportation is key. That's one of the most important things we have. And she really lit up and said, you know, that's one of the problems that I had. I said, well, in our community, because we're rural and we're suburban and but we don't have the transportation infrastructure. And so that voice is being heard in Sacramento. And I think that it's important for us to continue to let them know, so that when funds come down, they can say, hey, I know where we can put this. I know that we can get good mileage out of it. So I just want you to know that we are being heard.
Thank you, Cheryl. Thank you. And thank you for your ongoing support also in all of these, issues that affect older adults, caregivers, and individuals with disabilities. Yes, we are making some great strides with regards to transportation. Again, if you want to participate in any of these work groups, please let us know at info@inlandaging.org. Update on awareness that we're doing. We had a resource table at the Transdisciplinary Symposium series at Cal Baptist, where they focus on support for older adults on March 23rd. We will also be having resource tables, and the resource tables are going to be manned by Inland Coalition on Aging members to share information about the coalition and also about the Master Plan for Aging. And we will have resource tables at both the 36th Annual Adult Protective Services MDT Conference on May 22nd, as well as the Riverside County Elder Independent Adult Abuse Symposium on June 13th. Presentations that are coming up, where we're going to be sharing information about the work that we're doing. We did a presentation for the Inland Empire Disabilities Collaborative on March 19th, where Inland Caregiver Resource Center shared about resources for caregivers, and then also shared information about the coalition and the Master Plan for Aging. We've also been asked to speak at the San Bernardino County Older Adults Awareness Subcommittee on May 23rd. And we're also going to be speaking at the 36th Annual MDT Conference in San Bernardino on May 22nd. If any of you on here would like us to come and do a presentation to your staff or to your organization about the work that we're doing, please reach out to us. We're happy to be there. Or if you have any resource fairs that are coming up where we would be able to share information about what we're doing, if that would be beneficial, please also reach out to us again. And an update, we've created an ICA LinkedIn. So this is really new. So if you haven't, please follow us. And here is the link. We will be sharing this slide with all of you. Again, if you want, or please, we encourage you to like us or to follow us on our LinkedIn, and you'll be receiving updates through there as well about the work that we're doing. Next slide, please. And so again, awareness. We want your help in creating more awareness for what we're doing, in the hopes of getting people to support the effort of creating the Master Plan for Aging on the Inland Empire. But then also we're going to need help in implementing the Master Plan. So the more awareness that we're able to do about this project, the better. Next slide, please. And I'll turn it over back to Ben, who will discuss our next meeting.
What a packed meeting on information and exciting direction that we're headed. And I want to just tell you that the Honorable Cheryl Brown, who's with us today, is right. The information is getting to Sacramento and others, and I'm just excited for the work that we're doing here, because bringing the two counties together doesn't happen often, and when it does, you'd be amazed what we can do together. If you think about funding at the state level, if you think about regulations and funding that comes down to the counties, it all starts at the state. And so the reason for doing an Inland Empire as opposed to a San Bernardino separately or Riverside separately or a metro San Bernardino area, the reason why we're gathering all of them is because we want to make a big impact. And sometimes things cross over borders, right? We have transportation that needs to be better coordinated and funded between the two counties, housing. There's so many things that the both counties touch that's why we're focusing on an Inland Empire Master Plan for Aging and an Inland Coalition. I just want to thank Carmen again for applying for that grant. Thank you, Carmen. Great job in applying. And thank you to Inland Caregiver Resource Centers. Inland Caregiver Resource Centers really they provide a lot of administrative support, so I have to recognize them and thank you, Janelli. Thank you for all that you do in supporting us. Appreciate that. Did I hear a comment?
No, I just wanted to say one more thing.
Sure.
And I'll be quiet.
No, please.
In Sacramento, I want you to know, in Sacramento, Ben's name is on everybody's tongue. Everybody's talking about him. So Dr. Ben, I just say thank you. You are really, really doing a great job.
It's a team effort here. Everybody gets credit. If they're hearing my name, if they're hearing our name, they're hearing the Inland Empire and the work that we're doing. So thank you and congratulations to all of you who are making our name heard in Sacramento. Because of time, I don't want to keep you past our time, but next meeting will be Tuesday, April 23rd 1 to 12. Please join us. We look forward to seeing you there. And again, we're going to have a jam-packed agenda, so don't miss out. We'll see you there. And remember to visit our website and join if you're not a coalition member, so you can continue to receive updates. And we are going to possibly be talking about a conference coming up, so you don't want to miss those updates. Have a good day, everyone. Thank you. Thank you for all you do.